I would say one caveat you just would need to know, and this doesn't really even apply to my field that I am offering to clients with the KALON WEST platform here, is that physician assistants, if they are going to provide scheduled medications. Now, what's that mean? A scheduled versus a non-scheduled medication. A non-scheduled medication is something that doesn't really have a risk of dependency or high toxicity to a client or a patient. A scheduled medication is something that the FDA and DEA have recognized as high risk of either potential harm to somebody or misuse or abuse. So for example, testosterone, which we do use at KALON WEST, is a Schedule 3 drug. There are 5 different schedules or classifications within the scheduled drug range, depending on how bad or risky they are necessarily. Testosterone's not bad, by the way, but it could be abused, it could be misused, and so it landed itself a spot on the scheduling. Schedule 1 is top tier, meaning highest risk, highest scariness, highest baddest, potential for abuse and harm. Schedule 2 is next tier. This will be things like your opiates, so narcotics, Oxycontin, fentanyl, I think Norco, Loratab, things of that nature. Number 3 is like testosterone, and then there's 4 and 5, which are lower tiers. And so a physician assistant, independent physician assistant, as the law exists today, can prescribe Schedule 3 through 5, the lower tier drugs, to a client without a physician's supervising oversight signature. However, Schedule 2 has different rules, and Schedule 1s are usually just completely off the block. Hardly anybody uses Schedule 1s. So you should just know that. And KALON WEST will not offer Schedule 2s because they're not really relevant to our space anyways. I don't generally need to give a narcotic to somebody that I'm working with. But Schedule 3s are definitely on the list, and they definitely will exist and will be something that I'd be prescribing in terms of testosterone primarily, is the only one in that bunch. But because of that, you also should know that a physician assistant independently does have some different prescriptive rules around the scheduled drugs. And so a physician may be able, I'm pulling numbers out of my head right now, but may be able to write for a scheduled drug that exists up to 6 months in terms of maybe a 30-day script with 5 refills. Well, physician assistant independent in the state of Oklahoma as it exists today can only give and dose, for example, testosterone, a 30-day prescription of that drug with 2 refills, and then they have to renew the prescription. So there are some differences just kind of behind the scenes, and that may affect why a prescription is written a certain way. But in general, physician assistants independent in the state of Oklahoma can write for all non-controlled substances, so things like blood pressure medications, diuretic pills, antibiotics, steroid creams. They can write for all those things. But when it comes to controlled substances, they can only write for Schedule 3 through 5 for a certain amount of refills until they have to renew the prescription. And then they cannot write for Schedule 2s without certain other rules surrounding that. But for the purpose of KALON WEST, we don't need to talk about those things. So that's a little bit of the nitty gritty behind the independent physician assistants in Oklahoma. It's an exciting venture. It's a new terrain. And I'm sure it will evolve. Similar laws will pass also for nurse practitioners within that same legislative session. And so we shall see how this shakes down. It's been a little bit interesting because as one of the first independent physician assistants here in Oklahoma, as I've gone to different pharmacies, for example, compounding pharmacies that are multi-state licensed, they have not been up to date on the rules. And so I've run into hiccups saying, hey, well, I actually have prescriptive privileges that are unhooked from a physician at this time point. And often all it takes is me just talking to their compliance team and their legal team and kind of giving them the skinny on what's new on the block. But some pharmacies won't acknowledge that in other states. And so there has been a little bit of, pioneer discourse in that way. But here at KALON WEST, we have great pharmacies that we work with that will acknowledge the law and will abide by Oklahoma state laws. And it shouldn't be too big of a problem moving forward, especially since this will evolve. So it's an exciting time to be an independent physician in the state of Oklahoma. It is what has allowed KALON WEST to come into its flourishing creation. And stay tuned because there's something called the independent, or excuse me, not independent, called the PA Interstate Compact Licensure, which Oklahoma is a part of and did sign into legislation about a year ago, and is being signed into legislation with multiple other states, which means that in 2027, now that the board has been formulated, the rules are being promulgated, and the fees are being figured out. There's always something about money. What that means is that my Oklahoma license will serve for me to be allowing to practice in other states simply because I hold an Oklahoma license. There will be a credentialing process, there will be, applications, there will be background checks and all those things. But it's an exciting time to be a physician assistant, especially if you're one who's had the background training for a certain amount of hours, time, and service, and really have been able to create your craft and be certified by those who knew you in that field before the medical board, that then allows you to be unhooked from licensures of supervision so that you can do what you know to do and help people get well. And perhaps not just in Oklahoma, but one day maybe to several other communities too. So I wanted to give you a little bit of background on what an independent physician assistant is, especially in the state of Oklahoma. Does not exist in all other states, and we will see what it evolves to, especially as that PA interstate compact licensure comes around. It's an exciting time to be in medicine.